During this presentation, I will explain how medication reconciliation positively affects patient safety. Medication reconciliation is defined as a comparison of the patient's home medications with admissions, transfer, and/or discharge orders to ensure accuracy and patient safety. Medication reconciliation improves clinical outcomes by reducing adverse events. The Greater Baltimore Medical Center stated that across the United States, approximately 1.3 million people become ill or have adverse side effects from medical therapy each year. This process also eliminates duplicates from medication lists. The Agency of Healthcare Research and Quality noted that these discrepancies place patients at risk for adverse drug event, which have been shown to be one of the most common types of adverse events after hospital discharge. While nursing, I have seen patients take duplicate medication because their medications may be a different shape, color, and/or size, but they are the same formula. In addition, patients have medication lists that include drug names with similar spellings. This is an example of a medication list that has been correctly reconciled. It includes the trade and generic name of medications, descriptions, dosages, and usage. This example also includes the patient's healthcare provider's contact information, which is important for those patients that get home and think of questions to ask about their medication. In addition, it included the patient's information to ensure the right person has the right list of medications. Medication reconciliation also clarifies allergies and previous medication adverse events. During this review with the healthcare team, may stop an adverse event before it happens, stated by the U.S. Department of Veterans Affairs. While practicing as a nurse, I sympathize with patients due to the amount of information and the number of people they encounter during a hospital admission. With that being said, patients tend to leave out information about their history. During this follow-up process, we'll ensure all information is shared by patients and families. According to the Joint Commission, approximately half of all hospital-related medication error and 20% of all adverse events have been attributed to poor communication at the transitions of care. The American Pharmacists Association medication reconciliation improves medication between patients and healthcare providers. Medication reconciliation requires an interdisciplinary approach. Miller-Keane Encyclopedia and Dictionary of Medicine, Nursing, and Allied Health defines an interdisciplinary team as a group of healthcare providers from diverse fields who work in a coordinated fashion toward the common goal of the patient. The common goal for this team is to have an updated and correct medication list, which will be achieved by the process of medication reconciliation. Medication reconciliation allows patients to question the team about their medication regimen. The University of Rhode Island College of Pharmacy did a trial on patients 65 years old or older who were admitted for COPD exacerbation. This was a 30-day trial due to hospitals incur a penalty for 30-day unplanned readmissions. During the patient's initial visit, a pharmacist reviewed the patient's discharge medication list for discrepancies. Patients who were readmitted within 30 days were identified. The study produced results that were lowered from the baseline of 22.2% to 16%. With this process in place, the institution applying it will save money due to not incurring any penalties for unplanned readmission. The Joint Commission announced in July 2004 that accurately and completely reconciling medications across the continuum of care was the 2005 National Patient Safety Goal number 8. They also comprised medication reconciliation into 5 steps. Develop a list of current medications, develop a list of medications to be prescribed, compare the medications on the 2 lists, make clinical decisions based on the comparison, and communicate the list to appropriate caregivers and to the patient. In conclusion, medication reconciliation improves clinical outcomes by reducing adverse events, eliminating duplicates from medication lists, and clarifies allergies and previous adverse events. This process also improves communication between patients and healthcare providers due to requiring an interdisciplinary team. and also reduces readmission rates. In addition, was named the 2005 National Patient Safety Goal number 8 by the Joint Commission. As a practicing nurse, patient safety is the #1 goal while caring for a patient. Taking a few extra steps to ensure the safety of your patients by implementing processes such as medication reconciliation will prevent any detrimental events from happening while in your care. Patients trust us as healthcare providers to care for them during their most vulnerable time, and it is important that we take every step to help them without harming them.